I'm Vicki Liviakis, and welcome to Body Beautiful. It's the show where we talk with Bay Area doctors about the latest in cosmetic procedures, and we take your calls live on the air. It's a new year, and with us today we have plastic surgeon Dr. KRON Horton, followed by Dr. Heather Little. She is a doctor of audiology. Yes, you heard right. Later we'll be taking your calls and emails, answering any questions you might have about hearing, also about plastic surgery. Here's the number to call, 800-440-4884. We'll also be posting the phone numbers to the doctor's own offices, so be ready to jot those down. Before we get started, any advice we give you today, obviously you're going to want to consult your own physician. Welcome back, Dr. Horton.
Thanks for having me.
You know, last time we were here, you had show and tell, all kinds of breast implants. Today, you want to talk about mommy makeovers. It's a brand new year. This is a kind of a brand new procedure or set of procedures,
and oftentimes for a brand new you, for moms that have finished childbearing and that are looking to rejuvenate their breasts and their body after they've finished having kids.
Now, motherhood seems to be all about, you know, taking care of the kids, self-sacrifice, that kind of thing. And this is a big step for, you know, a person to take, isn't it?
Yeah, the Mommy Makeover procedure is a series of surgical procedures, so it's not something to be taken lightly. Often after a woman is finished having children, she can have a number of permanent changes in her body that cannot be corrected with diet and exercise. For instance, the breasts after having children, regardless of whether you breastfeed or not, can atrophy, which means the breast tissue actually itself shrinks. Also,
so it's not necessarily just from breastfeeding, but it
not
would happen.
necessarily. Yeah, after any pregnancy, there's engorgement of the breasts, and then there's atrophy, shrinkage, and droop of the breasts. So that's one part of the Mommy Makeover procedure. Surgical procedures that treat that are a breast lift, sometimes a breast augmentation, sometimes a breast reduction as well.
Now, we're not talking about a day at the spa. So,
no,
the caveat here is this is
surgical procedure. It's not something to be taken lightly. Any surgery involves risks, downtime that you don't always hear or see about on some of the other extreme makeover shows. They often jump forward, 6 weeks, 3 months, when all the swelling, bruising is gone. So there is downtime associated with surgery, but the results can be fantastic, and they can provide something that working out at the gym cannot.
Right, boost a mom's self-esteem. Mm-hmm. You know, you watch these young Hollywood starlets, they have a child, and the next thing you see them bounce back, they don't have an ounce of body fat on them, and everything is dandy. Come on. Is it just because they have a personal trainer, or are they going in for a little nip and tuck?
Well, it's tough to say, but I think if you work in the media 24/7, you most likely have a personal trainer, and it's your job to look good, and presentation is everything. So who knows what they do. If they go away for a little while and then look a little bit fuller or enhanced, then you can speculate.
You know, let's take a little virtual tour. We have some video of your office, and tell us what we're seeing here.
Okay. So this is the outside of the building. This is Judy. She's our front desk manager, and she will greet you when you come into the office. You can expect to spend at least 45 minutes with me when I see you in consultation, and we go over all the options. Here we're talking about breast implants, the different shapes, sizes, and the techniques involved with something like a breast augmentation.
And so much of, there was concern about leakage and silicone, and so everything has been...
As we talked about in the last show with me, silicone is safe. It always has been safe. It's been the most extensively studied medical device in the history of medical devices.
But people do have the option if they want to go saline.
Saline is available as well. And, when you meet me in the office, we talk about all the options and find the best fit in terms of surgical procedures for your goals.
Okay. When should someone actually start considering these procedures? I mean, let's say you've just had a child.
Definitely, you should wait at least 6 months up to a year after you've finished having all your children. There can be changes with one pregnancy, but the changes can be magnified with additional pregnancies. So a woman should be fit. They should be in good physical shape, have a healthy diet, be a non-smoker, limited alcohol intake. And as I mentioned, with each subsequent pregnancy, there can be changes. We've talked about the breasts. There are also changes with the rest of the body and the abdomen.
And we'll be talking about that. Also, you want to give your body a chance to bounce back on its own.
That's right. For
more information about Dr. Horton, call 415-923-3067, or you can go to womensplasticsurgery.com. And the first 20 callers who are watching the show, calling Dr. Horton's office, and you have to mention Body Beautiful, you'll receive a complimentary consultation. We'll be taking your phone calls and continue our chat about plastic surgery and mommy makeovers when we come back on Body Beautiful. Welcome back to Body Beautiful. We are talking right now with Dr. Karen Horton about mommy makeovers. We'll be taking your calls with any questions you might have, plastic surgery or the makeovers. Here's the phone number to call, 800-440-4884. We'll also be posting the number for the doctor's office during and after the segment, so you want to jot that down. And remember, any advice we give you today, obviously you're going to want to consult your own physician. Dr. Horton, we've got a lot of phone calls coming in, but you also brought some before and after pictures. I just think it's such a great way to just show people exactly what we're talking about. So let's look at the first one. There is a tummy tuck.
Yeah, so this is a woman, she's in her late 40s, she's finished her childbearing, and this is before and after a tummy tuck. And you can see the main thing that you notice, in addition to the enhanced abdominal contour, is a scar. Scars after plastic surgery are permanent, and I purposely show scars that are in the process of healing. Okay. To show that scars are red and they're raised, and at a year they're flatter and whiter.
All right, and get the bikini that covers them when you go out in the sun.
Exactly. The scars are hidden down low.
Okay, what's going on here?
And this is a breast augmentation after childbearing. So we talked about some of the effects after pregnancy. This is a woman who's had 2 sets of twins, and she has some deflation of her breast volume. We have not done a lift, but we have inserted an implant. So this shows an increase in the breast volume.
It looks pretty natural, too.
Yep, it looks natural and it feels natural. And this young woman had silicone.
Okay, do we have another picture here?
Yeah, this is another example of a tummy tuck. And this is a good example of showing she did not have a lot of additional skin, but she had loss of tone. And that's called rectus diastasis, where the rectus muscles themselves separate with each pregnancy. There's loss of collagen, loss of elastin, and the muscles themselves separate. So what a tummy tuck does is not only remove any additional skin and fat from the lower abdomen, but it internally corsets the muscles back together, and it recreates that nice, tight abdominal contour.
I've done it, sit-ups, push-ups, I've done it all, and nothing seems to be happening. Yeah. There really is a physiological reason
There could be some
for
rectus diastasis, separation of the muscles, and that is one of the things that a tummy tuck achieves.
Okay. Well, we've got Kelly on the line with us now from San Jose. Let's go ahead and take the call. Kelly, do you have a question for Dr. Horton?
Yeah. Is it better to lose the extra 30 pounds that you have before you have the surgery? Because I want to have both.
Definitely. If you have a goal of losing 20 pounds, 30 pounds, or your pre-pregnancy weight, it is a good idea to try to achieve that before undergoing any surgical procedure. So as long as your goal is realistic, and if you gain 30 pounds during pregnancy, losing 30 pounds is probably a realistic set point. Take 6 months, take a year, definitely, before undergoing any surgery.
Okay, Kelly, thanks for calling. Let's go to Tammy from Napa. Good morning, Tammy. I think Tammy's probably dealing with the kids at this point. Tammy, can you hear us? You know, I think Tammy's a little busy here. Okay, we've got an email from Molly in Corte Madera, and she has a question about, she lost a lot of volume in her breasts since having her second son. Now, the question is, implants, would she need them if she got a breast lift?
Well, that depends. It depends how much breast tissue is left over. As we talked about, after pregnancy, there is some loss of volume, and there's also some droop associated with the breasts. The nipple can be pointing towards the floor. The areolas are often stretched out. What a breast lift does is lifts the breast tissue mostly by excising, removing extra skin. It lifts the nipple and the areola up to a higher position, and it often decreases the diameter of the areola. However, the volume will be the same. So if the goal is to increase volume, say back to before pregnancy, or sometimes even during breastfeeding, women are very satisfied with the volume of their breasts, then often a lift in association with an implant would be recommended.
Okay. We've got another email from Vanessa in Sausalito. She's concerned about, you know, the pictures kind of show that. Would people be able to see the tummy tuck scar if she's wearing a bathing suit?
The scar would be visible when you're naked. It would not be visible in most types of underwear or bathing suits. And that also depends on the styles. Back in the mid-'80s, the very high-cut, you know, handlebar type of bikinis were in fashion, and so the scars reflected that. Nowadays, there's more, you know, hip-hugger jeans, low-cut bathing suits, and so the scars are reflected in that.
And I guess
so if
it's
you
also,
have
your ability to heal, and you know, some people scar worse than others. Unfortunately, we are plumb out of time. We had another couple calls. We're going to have to, have you back, obviously. For more information about Dr. Horton, call 415-923-3067 or go to womensplasticsurgery.com, and the first 20 callers to Dr. Horton's office that mention Body Beautiful will receive a complimentary consultation.